Thank you, Leah. Good afternoon, everyone. Thank you for tuning in to our first office hours. We're going to dive into a case with a couple of units. So let's just take a look at what we have here. This patient presented with existing restorations on both 30 and 31. So a full coverage, all ceramic crown on 30. You can see on 31, there is an existing composite. So why did he come to us to begin with? He was complaining about some pain upon biting, and I kind of narrowed it down to 231. I've been seeing a pretty high incidence rate of these among our patients. Anytime there is discomfort on biting, especially when there is an existing restoration, is the existing restoration debonding? Is it delaminating? Is it leaking? We can see some signs of leakage there on the class 1, but there's also a little fracture line through the distal marginal ridge that I suspected perhaps that, depending on how deep the crack is, certainly could be contributing to the discomfort as well. So these situations, I like to remove the existing restoration. Let's see what's going on underneath. And then through the fractured area, let's try to dissect as much of that as we can within reason. Of course, how much tooth structure to remove until we can get to sound tooth structure underneath. The full coverage restoration, that is an endo-treated tooth. So there were no apical lesions, periapical lesions, so I didn't suspect the discomfort from there. And during the initial test, I like to have a patient bite on a cotton roll, and he did note that 31 was the source of the discomfort. So here's a buccal view, taking into account number 30. When we're planning these cases, if the existing restoration or the preoperative tooth has good contours and morphology to it, it's functioning well, most of it is intact, there is a chance we can just use this as there's an additional option for us to use that contour for the new design. And that is the plan for this case. So what we want to do preoperatively is to scan in this quadrant for our pre-op or pre-treatment scan. And so you have to set that up on your particular scanner. Here we're using the Medit or FastScan i900. And we're going to lay our foundation with an occlusal scan. We like to scan from the most terminal tooth, last tooth, to the cuspid. And so we lay the foundation from last tooth to, in this case, 27. And we're going to do our rotational scans. For these pre-op or pre-treatment scans, you want to make sure you rotate well as if you were scanning the prep. So rotating almost to 90 degrees on the lingual and the buccal so that we can capture all of the contours we want to duplicate. Now, here in the Medit scanner, we can scan the opposing as well and go ahead and capture the bite of the pre-op. And then we'll add in the preparation later, the prep scan. So here for the prep, I'm always using round-ended tapered diamonds, so whatever length that fits the area of the mouth. And here I'm actually starting the prep through that distal marginal ridge, just taking away that fracture and then extending it into the existing class 1 composite. And whenever it's a composite, I'm hoping that it's a more conservative preparation. But a lot of times these composites were done to replace amalgam restorations. And so what we know about amalgam restorations, those have to be retained. And so the base of that preparation will most likely be wider than the occlusal aspect, the external outline. So that's just something to keep in consideration. Whenever we're prepping for an indirect restoration, when we're milling it, we want to have divergent walls on the inlay, meaning the upper portion is wider than the base. So just some things to keep in consideration. Now, the preparation, I'm just getting a good look at that distal marginal ridge, just trying to eliminate the fracture line. Fortunately, it didn't go down very far. Now, the plan, I forgot to mention, the plan we want to do for this patient is a DO Inlay out of CAMouflage. And for number 30, we're going to replace that crown with a BruxZir NOW crown. Now for the preparation of number 31, you can see I'm taking the perio probe here, and what I'm doing is I'm measuring to a depth of 2 millimeters. We want to have a depth of 2 millimeters so that we can establish adequate material thickness in the final restoration. So some key areas to measure, I would recommend measuring where the grooves are. So you can see I'm positioning it on the buccal groove, and I would do the same thing on the lingual groove and also at the marginal ridge position. So these three zones are going to be really critical because those are the lowest areas on the morphology of a molar. So whenever you position your perio probe, just make sure you measure down to a depth of 2 millimeters to ensure that you have enough bulk of strength in your restoration. All right, so we'll look at the preparation in a bit more detail once we get to design. So I know that we don't have the perfect angulation with our camera here. Now to remove number 30, we're going to section. I cut through on the buckle, occlusal. You can see I do a little cross on the occlusal so that I can position my crown separator. See, I'm positioning it from mesial to distal. When I rotate, I want for the forces to be applied toward the lingual and buccal. And with these all ceramic restorations, you can pretty much suspect that the way it was cemented was bonded in, adhesively bonded in. So it can be quite a bit of trouble to take that away or to break away the old restoration. Now, when I did this, you can see it almost looks like the distal lingual portion of that tooth sheared off. I'm not sure if that portion perhaps debonded or fractured away with part of the previous restoration during that separation. So just something to keep in consideration. I have for sure seen it. I wasn't sure here the fragment was suctioned away before I could evaluate it. But in this instance, fortunately, its tooth was endo-treated. We didn't have any major issues, but you can see the fracture actually went down pretty far. So whether it was there before, I didn't notice in the pre-op evaluation, but certainly during the separation of the existing crown, potentially could have done some damage. So, but the best thing we can do is just to smooth out the preparation, and adapt it to our all ceramic guidelines and what we'd like to see for the milling system. So for the prep, sharp cable surface margins on both the inlay and the full coverage. I would recommend reduction of at least close to 1 millimeter. I say shoot for 1 millimeter, hope you get at least 0.5 millimeter at the margin. Using round-ended diamonds or round-ended burrs will allow for a chamfer, or we're shooting for more of a deeper chamfer margin for adequate material thickness at the margin, and rounded internal line angles, especially at the transition from axial to occlusal. Let's just continue playing this out. We can see a view from the buckle here. So again, making sure we have enough clearance. So with all of the materials that we have on the mill, even though we're planning to do a BruxZir crown, we want to have at least 1.5 millimeters of clearance from the opposing. A little more, even better. Of course, the shorter your prep goes, now you've got to consider the retention or retentive aspect to retain the new restoration. But here we have plenty of clearance, and could have rounded this corner a little bit more, but roundish corners, axial to occlusal. Now for the preparation, we want to make sure the site is isolated well. Here on the Medit scanner, we can delete the pre-op teeth of number 30 and 31 and go ahead and just focus the additional scan for the prep just in those areas, because it pulls or utilizes the pre-op of the adjacent teeth or neighboring teeth for that prep model. Now here we want to make sure we rotate well enough to capture the contact surfaces of the adjacent teeth Why is the model in green? If you're not familiar with the Medit scanner has this what's called a reliability map. So there's color, there's stone, this reliability map. What that reliability map does, sorry about that. What the reliability map is indicating is when it's this bright green, the density and quality of the data that you're capturing. So you can see if it's missing, you'll see a hole. If it's borderline, just kind of a little bit of information, it's more than this orange or a reddish color. So we're really just rotating and allowing for the light on the scanner to come into contact with all of the critical areas of the prep and, of course, the adjacent teeth, the internal walls of the inlay. And if we see any missing areas, it's really obvious when it's not green that we have to angle our scanner a bit better. So let's go ahead and take a look at the design here. So this is what the case looks like once we open it up. So starting off on number 30, with full coverage crowns, the software does pre-place the margin using the margin AI function, but it's rarely, if ever, 100%. So we do still have to modify certain areas of this margin. So I'm just going to start off here on the mesial buccal side. I can see that very clearly. We're going to shift this out, and I'm just going to work my way around clockwise. Now, we can utilize, if you've prepped, and also good tissue retraction. In this case, I actually didn't use any retraction cord. Most of the prep was left either equigingival or supragingival, as you can see here. So we can use the lighting. If you've made a sharp edge on the prep, you can use the lighting of the software to help guide the placement of the margin. And you'll see certain areas where there's no retraction or no sharp edge, how I'm going to position it. Some additional aids during the margin marking, we can activate the curvature function up here, upper right. The curvature function will highlight those edges so you can see the lighting, but also the contrast and color provided by the curvature function. And so here, working our way distal buccal, this area looks pretty good, straight distal, but once we go to distal lingual, it's a little bit over or past the margin. We're going to shift this inward. And this is where maybe that portion of the tooth kind of chipped away. Again, I'm not sure exactly. Anytime we're removing old restorations, it's always questionable what we're going to uncover. An area I would have liked to have improved on, and let me turn this to stone and turn off the curvature for a second. You can see how the curvature also highlighted this sharp area at the shoulder of the margin or shoulder of the prep. So ideally, I could have gone back and smoothed that out. All right, so here, straight lingual. Let me go back to color. So anytime we are getting equigingival, even with the soft tissue, the color function certainly is very, very helpful. And so here, I'm going to shift this. We can see down. This is basically the soft tissue meeting the hard tissue, a bit of the sulcus here. I'm going to shift this up a little bit. And now working our way toward the mesial lingual. Once we reach this zone here, let me turn the curvature off for a second, because sometimes it is helpful, but when you have kind of a broad, sharpish area, you can see how it highlights a good portion of that. So I intended for the margin to be up here. So I'm going to shift this upward. Straight mesial, we're going to shift that upward. And straight mesial a little bit more here. There, I adjusted the size of what we're moving. And that's our margin on number 30, maybe here on the mesial buccal. Let's bring that out just a little bit. And so while we're at it, we can go ahead and take a look at the occlusal and buccal arrows. I like to position this, imagining going from mesial to distal, and we're looking straight down on the occlusal plane. So tooth number 29 is actually shifted toward the buccal. So I'm looking more from 28 to 31. Again, imagining we're looking straight down on the occlusal table or occlusal plane, and then we can double left click on the blue occlusal arrow to define our occlusal position. And the buckle, toward the buckle, that initial starting point was pretty good. So now let's go on to 31. 231, inlays and onlays. Currently, the software does not replace the margin because it really is a little bit confusing even for us as designers. So the software, when it doesn't replace the margin, it utilizes this function called autocomplete, where it's looking for an edge. And there's a lot of edges on this prep. There's edges on the cusp tips. There's edges, certainly, of course, hopefully on the prep. And we can see the outline of my margins pretty well, but it's still having some trouble. And you can see this is where it wants to draw the margin where the red line is. I usually will try to give autocomplete a chance, but that actually was close, but it jumped so quickly. There we go. Oh, let's try that again. That was a pretty close one. But if it's really, really off, then you may want to consider deactivating autocomplete. Once you deactivate it, you can have full manual control. And yeah, I got lucky on that one. So they got most of it. Again, it's not perfect. So let's go ahead and look at areas that we can improve on here within the box. Let's just start in the box. We can open this out a little bit. And as we track vertically here on the distal lingual, and now we can see this is where my margin is tracking. So this is an area that we do want to improve on. So we're going to mark the margin here. And just to show you with curvature what that would look like, it highlights it pretty well. There it's a little short, so I'm double left clicking and just drawing a new line there right across. A new segment will form. That looks pretty good. Usually with inlays and onlays, I try to, especially on the occlusal portion of the preparation, I don't take the margin too far out, right? Especially with this highlighted curvature area. I usually will err more just slightly on the inside, if anything. The reason for that is there is sometimes a risk of the restoration binding on those aspects of the restoration that is going maybe beyond the margin. This arrow is kind of in the way. Let's look on the straight buckle. As I rotated it, goes out of the way. And so now here on the mesial lingual, let's see, we can shift this down a little bit and just bring that up. So some other areas that you do want to also pay attention to with inlays and onlays on your margin, these vertical portions within the box, it could potentially cause a hangup if we track the margin too far beyond like that as well. So here I'm going to, again, err just slightly on the inside. All right. And as I go through this, as Leah mentioned, if you have questions, feel free to drop it into the Q&A section, and she'll interrupt me if there's anything that's coming through. All right, so the margins are set. Once with inlays and onlays, and this is a real easy example because all of the cusp tips are present. The way that we want to define the occlusal is imagine a table, and I can illustrate this with the grid. Imagine the flat plane, and not all the cusp tips are the same level, but imagine if you had a plane just kind of touching all four cusps. We want for the occlusal to basically be perpendicular to that plane. So we can kind of establish that looking straight down, again, looking straight down on those cusp tips. And then we're going to double click on the blue, and that should be close to perpendicular for that occlusal plane. One final note, let's just get a bird's eye view. I'm going to hide the arrow of 31. I'm just going to lower right and uncheck occlusal and buckle directions. So when we look at the preparation with inlays and onlays, ideally, we want to be able to visualize all of the margins, all of the internal walls, and certainly the base. So if you can see everything, and the same is true with crowns as well, right? On a crown prep, we want to see the margins, the walls of the prep. Now, I know what you're probably thinking. Well, okay, so what happens if there is an undercut? So first of all, with crowns, if the margin is covered by a vertical wall of your preparation, then that's going to be problematic. You're going to have certainly some sort of seating and definitely some seal issues. The system's not going to be able to reach around that undercut to the margin. So those are catastrophic issues. So anytime the margin is covered by some aspect of the prep, there will be an issue. But if there's an undercut, let's say there's an undercut on the vertical wall, but from this bird's eye view, the margin is outside of that undercut, you're not going to have a problem because the system won't be able to actually mill the undercut or mill material within that undercut. So essentially, you can consider that area to be blocked out. So no worries there. And the software still will warn you if there is an undercut. It's just designed to do that once the insertion axis is defined. And you would see that once you hit design. And we'll see, who knows, maybe there will be a warning here. But now on the inlay, for the inlay, all of the margins are beyond the internal walls, which is good. But let's say there was an undercut inside within the walls. How would the system manage it? It would also block it out for you. So there's very few times when undercuts are going to cause a catastrophic issue. And the main one would be, as I mentioned, for crowns, if one of the vertical walls is shielding or covering the margin in whatever insertion axis the software needs to seat the crown. And so we can look at the insertion axis once the design is generated. All right. So these are the preps and the margin marking. Final thing on the inlay prep is, again, making sure we have enough depth of the preparation. So we want 2 millimeters down. So those areas that I measured, and we can try this in the software. We've got our measure tool on the left-hand side. Let's turn off the pre-op. Anytime we turn on the measure tool, the other models pop up. So let's measure down from margin of that mesial marginal ridge down to the base and close to 2. Maybe it goes down a little further, but close to 2 is what we want. And here on the lingual, over 2, that's great. And then this point on the buckle groove, again, where the cuss tips are, it's easier to get the right depth. Of course, you can measure there as well, but these are the areas that I really want to be sure that we have enough thickness. It's less. Let's see, one more time. Let's see, down to the base here. Okay, close. It does slope a little bit down at the base, but again, close to 2. When I measure with the probe, sometimes it's not 100%, but at least if we try to evaluate it, we should get close. If we're less than 2, then I'll certainly make another pass with the burr to make sure we have enough depth. And hopefully, once you establish the depths along the sides of your prep, the base of your prep should be at least equal to, if not maybe a little lower. Right now, let me see if I can cut away this soft tissue that's getting in our way. I'm going to go to the scissors here. Within this is called scan repair. We're going to cut away this tissue on the distal, maybe on the buckle as well. See if we can visualize the prep a little bit. So the base of your prep in the middle, at least even, if anything, maybe a little lower, because as the design generates, right, the central fossa of our design usually is going to be the lowest point of the occlusal. All right, so there's our prep rounded internal line angles, making sure things transition more smoothly if we can. All right, so let's go on to the design. So once the design generates, most likely the initial design is going to be with multiple units, the library proposal. So we'll review the options for the design. The library proposal is basically just generic library teeth, generic morphology for whatever teeth you're working on. The other option would be the Crown AI. That is the AI generated proposal. The AI does apply for both inlays, onlays, and crowns. I think most of you are familiar with the Crown AI, certainly utilizing and benefiting from that. So these are the library teeth. The way that we can tell they're library teeth, the contacts are not generated, the occlusion's not generated. It just kind of drops basic library teeth in place. And now you have the freedom, I'm just going to move, rotate, scale here, to move things around as you wish. Just to show you the other options, I'm on the upper left here under proposal. In the drop-down menu, we've got Crown AI. Let's just see what the Crown AI does on number 30. Usually for full coverage crowns, it does a fairly nice job. Complicating things is the rotation of number 28. But decent crown, maybe the occlusion, a little bit, you can see that upper tooth is also rotated, like the mesial buccal of number 3 is kind of turned in. So we'll see how we manage that. The occlusion, even off the AI, I would actually try to get the cusp tips of the lower molar into the central fossa of the upper within reason. Now let's hide the design for a second, and let's take a look at the pre-treatment model. And so that was the original position of number 30. Not bad, certainly within occlusion. That tooth is kind of coming down right onto here. We can see it's not bad. Let's look at the design generated by the AI and just kind of compare. Let's hide the upper. And so the AI proposal is all within the original design. It's close, but you can see there's quite a bit of material it's under contoured. And so if you were really wanting to duplicate the original, we do fortunately have that function. So let's navigate back to the design options. In the dropdown, we can change that to copy restorative site anatomy. Whenever we select that, let me hide the model for a second. So whenever we choose copy restorative site anatomy, we then have to hit adjust. So we're going to click on adjust. And this takes us to the section where we get to define how much of that pre-op tooth we want. And this is why it's important to scan the pre-op tooth really well. So you can include as much or as little as you want. Usually we want to include a lot of it, especially if you're making a survey crown under a partial. Patient has an existing aligner or removable appliance. You want for those to adapt to the same contour without having to remake that appliance. Lots of good benefits from using pre-treatment. So here I'm just adjusting, I'm left clicking and holding and moving that line down to include more of that pre-treatment restoration. You can see pre-treatment also applies for inlays and onlays. So the software with multiple units, it does default to copying whatever has many units as there are in this pre-treatment format. I think we need to improve on this. We need to define, okay, let's say we want 30 to be copied, but 31, we want to use a library, for instance, because you can see we may not want to copy the lack of anatomy that was there on the class 1 composite. So that I actually will try to do that on this case. So I'm focusing the copy on number 30. But you will see once I hit apply, the software is going to copy both of the pre-treatment morphology. So we like number 30, but for 31, we want to improve on the anatomy. So let's go back. Let's see. It's kind of funny right now. It's not a really smooth workflow. So this should be improved at some point. So let's go to 31. We're going to go to the design options and change this to library now. Let's say, hey, we want library. Okay, so now that's how we would apply the library. But let's say the library proposal didn't, and hopefully you see that. I'm going to undo for a second. You can see the original copy. That's the pretreatment copy. And this is library. So you can see an improved anatomy on the occlusal. Now, let's say the library function, if you hit library, the initial positioning of the library tooth was not correct. And so I won't spend too much time on this, but you could go to adjust and change and modify that library position. But when you do that, just to show you, if I move this, when I hit apply, notice it's now going to change number 30 to a library as well. So if you just hit library, as you saw, it will change just number 31. But if you modify the library tooth, it unfortunately now changes 30 as well. But to bring 30 back, we'll go to 30. And then this is unfortunately, this is the unfortunate workaround, but it is doable. We can go back to copy restorative side anatomy and bring back that copy tooth. We've already copied what was there. So now we have a library design on 31. We have our copy on number 30. So let's focus on number 30 and get this design dialed in. Now, I'm going to first actually turn off the contacts here. And I just want to show you some areas I want to improve on, or an area I'd like to improve on. I want to actually correct this crossbite here on the mesial buccal. Everything else looks okay. The buccal cusp is, see how it's rolling into the central fossa of the upper? That's what we want. On the lingual, I think this is okay too. If anything, normally the occlusion has the lingual cusp tips a little bit farther lingual, but this is okay. You know, the patient has good interdigitation. But the only area I would like to improve on is this mesial buccal. You can see we're lacking the cusp position in the central fossa. So what I'm going to do is use freeform. I'm going to increase the size of freeform, the area of influence. You can slide this to the right, or you can use the mouse, right click and hold, and followed by the left click up and down. And then I'm going to move this to the lingual. I'm going to move it to the lingual and move it more occlusally. So let's shift it over. And kind of a neat way that you can also look at this, you can just move it until you think you've reached the point and then evaluate it again. Or you can also maybe look at the cusp or whatever area you're trying to move through the opposing. So just to show you here, and it actually is a bit clearer if you turn this to stone. So I'm going to turn off the colored model for a second. So notice the central fossa of the upper number 3 is right there. And that mesio-buccal cusp, let's see if we can get it to about this middle area. So I'm shifting it to the lingual. And now we want to bring it toward the occlusal. So what I can do, and what we all can do, is on the keyboard with the freeform function, if you hold control in the keyboard, you're able to bring that area up. So you can see how that arrow appears. So without the use of control, whenever you use freeform, it's based on your view, meaning we can't actually pull toward us. We can only shift that toward the lingual or buccal, mesial, distal. But regardless of your view, when you hold control, now the freeform will function to raise or move that surface according to how that blue arrow is pointing to. Another use of the keyboard is to hold the shift key. The shift key, notice how it's jumping around. The shift key, that blue arrow is angling the direction of the move based on where that surface is currently facing. So that's why it's jumping around a little bit. The control is fixed, and that is based on the insertion axis, which is in 99% of cases toward the occlusal. All right, so let's get a side view of this adjustment. So now the cusp is kind of going into the central fossa. That looks good. Maybe a little interference here on the buccal. Let's see if we can see on the lingual. Yeah, not really, but I think we can raise that cusp a little bit more. So I like to do this to improve on the functional areas of the tooth. So let's just raise this up, and we will see this reflected in the color of the contact. So let's take a look at the contact. We've got our cusp or contact on that mesial buccal. Let me broaden this a little bit because the original cusp shape was a little bit sharp, and I'm going to smooth that down. And this way we have kind of a nice rounded cusp for this patient to chew more effectively with. All right. So that's the adjustment that I will often make with our restorations. Even if we're copying the original, can we improve on the functional aspects? Even with the AI, there are often situations where you can improve on the functional areas because sometimes the software keeps those functional cusps a little low just to avoid excessive adjustments. But if they're positioned correctly and at the right value, you shouldn't really run into any issues. So now that the cusp is in a better position, let's take a look at what adjustments we have to make to finalize this design. So let's navigate to the contact window. So the contact window allows for us to adjust the occlusion, the proximal contacts. If there are any thin areas, it will also take that into account, as we can see here on the buccal. So let's just see for a second. Anytime we are going to use the fixed contacts or the contacts window section, I like to first evaluate how broad the contacts are using the edit mesial and edit distal spot. And there's something, let's go ahead and look at the edit mesial. So the edit mesial contact is here. It's the mesial contact with number 29. And you can see it's positioned a little bit close to the buccal. I like to center the contact. So notice how using the reflection of the software, we can see the broad area of the neighboring tooth. I like to position, well, first visualize where that contact area is and then draw it right along there. And if we view from the top, we can see how that's facing our preparation. So that looks good. Let's go ahead and save that. Now for the distal, notice how there's no distal value to the contact. And this is actually a bug in the software. Oftentimes, if you don't see a value on one of those proximal surfaces, you could use the edit distal or edit mesial function and basically draw and tell the software, hey, there is a tooth here and a contact here. Let's define it. But I noticed this, and I guess I really haven't done any crowns next to a distal facing partial coverage before. But what's going on is the software has a restoration on 31 and it's looking at 31. Notice how that red area can be drawn on the design, but it's not coming into contact physically with 30. So that's why the software actually doesn't know where the tooth is or that there is, in fact, a contact. So what do we do with that situation? I'll show you here in a second. Uh, let's go ahead and get the software to adjust what we can. So for BruxZir crowns, I like my proximal contacts at 0 and my occlusal contacts at -350. Now, you might be thinking, hey, we copied the original design. We can see most of it is contoured exactly where it was. Do we still have to adjust the contacts, the occlusal contact position? And the answer to that is currently yes. So I'll show you here. I'm going to go ahead and hit fix contacts. And what the software is going to do, just to review, it's going to take the occlusal heavy contacts down to -350, and it'll bring at least just the mesial contact to 0 and to the broadness that we just defined. And then also this thin spot should be filled in. So let's hit fix contacts. So it broadened the contact. It got the mesial contact to 0. It took the occlusal contacts down. It filled in the thin spot. Let me undo for a second so you can see it. And notice it's a minimal adjustment. Now you might be wondering, we copied the original. Why did we have to still adjust the occlusion for 30? And that's because there is a bit of an error that occurs during the milling of BruxZir NOW, especially with BruxZir NOW. BruxZir NOW, the occlusal surface just comes out a little bit higher. And so we're compensating for that error during the machining because it's very hard to machine centered zirconia the way that we are. And so we're just accounting for that adjustment. And it's small enough, fortunately, that this is going to be very, very close to where, extremely close to where the patient's original contour was. All right, so the area where it didn't adjust appropriately, so that mesial contact looks okay. Something that I would still recommend looking at, hide the model and just look at the area that you did broaden. Sometimes the software does wrap around, especially if you draw that red area pretty large. So sometimes I will still take the smooth function and just smooth the edges of where we broaden just to kind of eliminate any areas that might be over contoured and creating kind of an unnatural adaptation to the adjacent teeth. All right, let's just look at our model again. Let's go back to color. We don't have to go to color, it just kind of maybe looks a little bit more correct for most of us. So we can see that occlusal mesial buccal cuff looks great. Now let's go ahead and look at our distal contact since the software did not adjust it for us. So what I like to do, or what I did for this case, is we can see what portion of the design extends into number 31. Now, how much should we take away? I'm just going to go ahead and compare and evaluate. What does the mesial contact look like? Notice it's right on. So just to show you, if we add a little bit to that surface, you can see how it's now penetrating through 29. And if we smooth this down, which is normally how I would manually adapt the contact. So notice there's just a tiny bit of the mesial poking through. And so that's about what we're going to do for ours. And if you're concerned, of course, you can have a little bit more material. So I'm going to increase the strength just to speed things up. And now I'm left clicking and holding and smoothing that contact area down. If there is a lot of material coming through, for sure you could use one of the more aggressive tools like freeform or the remove function to speed things up. But we're getting pretty close here. I didn't go all the way. May not make a huge difference, but let's just see what's going on. Sometimes, especially once you're creating more of a concavity in the design, it does slow down. I'm just going to smooth around these edges a little bit. You can see once we kind of get rid of those edges that are kind of the outer bowl of that concavity and kind of speed things up. But this is at least much closer than where we were, right? There was a lot of material coming through. So as long as we still have contact, we should be good. All right, so that is number 30. Let's take a look at 31. For 31, fortunately, no proximal contact. Let's take a look at our contact window and we can hit. So I'm going to show you this for a second. So see, there's mesial active. The software believes it knows there's a design on 30, and this is something that needs to be improved on in the software. But you can see when I hit fixed contacts, notice this mesial side. See, it's just reaching over. There's extra material trying to touch. It actually does come into contact with 31 or 30, excuse me. But we don't want that, right? So if you ever see that happen, I'm going to undo. We're going to have to turn that contact area off. How do we do that? We're going to click on the mesial tooth in the contacts window, turn that off. And for CAMouflage, we're planning CAMouflage for 31. For CAMouflage occlusion, we like -200. So -200 is the default for the system for all materials, but with BruxZir, we do find we have to go to a little bit more aggressive reduction. So hitting fixed contacts now, the software will only adjust the occlusion. And you'll see this error or warning on the top. It says unreachable contact value. We set -200. However, on the occlusal, it says 60. And the reason for that is, and this is often the case with inlays and onlays, anytime you have the margin terminating somewhere on the occlusal, the margin locks that portion of the design. So we're now kind of getting into the zone of thin material and the inability to drop the material down enough to reach the value of that contact that we've defined. So that's not a big deal with these inlays and onlays. I will mill it as is, and then for the occlusal adjustment, we'll do so once we've bonded the restoration in. I might just use a smooth a little bit here, but for sure you won't be to take this down to the value that you've defined, most likely. So that is the design. And if there are any questions, I'm just going to check in with Leia. Are there any questions with the anything we've covered so far?
There are no questions at the moment.
All right. So let's go back to the finishing of this case. All right. So these restorations milled out. It was about 33 minutes for the BruxZir NOW crown, which is an improvement from what we've seen at the beginning. So great job by the engineering and software teams to continue to make improvements on making it more efficient for us, which is great. The inlay milled, I think it was around 9 minutes. It wasn't very long, but just under 10 minutes for this mill for the inlay. And what's great is the software does thin the sprue. If we did have, let's say, a 32, a distal neighbor, that will certainly affect the seating of that. So something to keep in consideration even during the preparation of the case. Maybe your box increases in size or width from buccal to lingual to maybe allow for you to sneak the sprue away from dead center of that contact. But it is thin enough, so hopefully the adjustment, it shouldn't be too bad. All right, let's review the delivery of these restorations. So for the BruxZir crown, we did actually air braid the restoration. So we try in the restoration first, and after we seat it, we do air braid it. We don't always air braid. Air abrasion is really truly only necessary whenever you have a very non-retentive prep. So overlays, onlays, short clinical prep height, so 3 millimeters or less than 3 millimeters, I will usually air braid and follow a bonding protocol. But if you have a retentive prep, which this prep, it's kind of borderline. Most of the buccal, some of the lingual is at least 3 millimeters in prep height. I've had good success with at least a couple walls, at least at 3. Mesial distal, sometimes those are a little shorter once we do establish the right clearance. But for this case, it's kind of borderline. So air abrasion, if you have a sandblaster, great. If you don't have a sandblaster, I do recommend getting one. It can only benefit your deliveries of BruxZir and also CAMouflage, which do need to be air braided every time. So is there any harm in air braiding the BruxZir? There isn't. So you're only going to improve it. So the sandblasting, what it's going to provide for you, it's going to clean the surface. And the big one also with bonding is it's going to roughen the intaglio surface. So we air braid with aluminum oxide, 50 micron aluminum oxide. After we air braid, there's a little bit of residue of that aluminum oxide on there, so we'll rinse and dry it. And then we use the BruxZir cement. So the BruxZir cement that we're using is a dual cure self-adhesive resin cement. That cement is a resin-based cement and can be utilized for adhesive bonding, which we're actually going to use for the CAMouflage as well. But the cement can be improved upon following additional bonding steps. So air abrasion is going to improve it. On the restoration, if you had a true short preparation, I would recommend applying a zirconia primer, something that contains MDP, like a Z Prime from Bisco, Monobond Plus from Avoclar, or many universal bonding agents such as Scotch-Bond Universal or OptiBond Universal contain the phosphate primers for zirconia. That will improve the bond to the air braided zirconia. So that will definitely enhance the retention with BruxZir cement. On the preparation, what we did here, I'm going to classify this as retentive, but again, it's kind of borderline. Maybe the walls are a little tapered, especially that distal lingual area. So on the prep, across the board, ensure no contamination. If there's bleeding, get that under control as best as you can. This patient actually had a lot of heme, a lot of inflammation during the preparation. So you probably noticed there was a kind of a bit of some coagulant after the hemostatic use. On After ensuring that contaminant free, you can optionally etch the tooth. We didn't etch the tooth here. I would certainly etch if we're doing a veneer case or an overlay with BruxZir. Another additional step or optional step would be to apply a desensitizer. Gluma is usually what we're using in our clinic. This is an endo-treated tooth. With endo-treated teeth, I usually don't worry about it. Some studies have shown it does improve bonding, but again, I'm just trying to apply an approach where there's the most minimal amount of work that we have to do, but there's no harm in following a bonding protocol for every case, and maybe that's something you choose to do to simplify and really maximize the adhesion to the prep. Why not if we have the option? But I'm just really just pointing out truly the optional steps. And then the last optional step would be to scrub in an adhesive. Again, this will enhance the resin cements bond to the tooth. Many self-adhesive resin cements will benefit from the additional application of the adhesive that creates a much stronger bond. All right, so that's the BruxZir cement protocol that we use for this case. On the CAMouflage, this is what we're going to do for every CAMouflage case: inlay, onlay, crown, anterior, posterior. We want to really maximize the adhesion to the material. So after we try it in, we're going to air braid the restoration. That's going to roughen the intaglio, rinse and dry to clean it. And then we apply Scotch Bond Universal or some similar bonding agent or adhesive to the internal. If you're using a 2-bottle system, you want to apply the adhesive second bottle. Once you apply that, that's going to interlock with the roughened areas of the restoration to help improve the adhesion to the cement. You can air thin that application of the adhesive, and then you have the option to cure at that point. I know some of you are worried about the film thickness. If you're concerned about that, most systems will work fine without curing or pre-curing the adhesive. On the preparation, we're going to consider all partial coverage cases to be non-retentive. So we're going to ensure that there's no contamination. Again, that applies across the board. And for this case, we do etch. So I say optional etch. It kind of depends on your bonding agent. You may have a single bottle system where it self-etches the preparation, and that may have worked great for you. And that's why I mentioned optional. For our sake, and this is my preferred approach, I am going to total etch with phosphoric acid for at least 20 seconds. Following the etchant, this is a vital tooth. We're going to apply a desensitizer. So we take our Gluma and scrub that in, let it sit for at least 1 to 2 minutes, and we don't rinse it off. If there is excess, we'll aspirate that. And then we can immediately follow that with an adhesive. This is a non-negotiable. You have to scrub in your bonding agent into the tooth, any exposed dental areas, any areas along the margin, just the entire prep. Scrub this in really well. This will create the hybrid layer to maximize the bond between the cement restoration and your preparation. All right, so let's take a look. This is during the seating. This is a great fit of the inlay. Now, just to point out a couple of areas, what the software does at the margin, and this is for all cases, it's just maybe a little bit more apparent with partial coverage. You can see a little bit of extra material beyond the margin. That's the software's material thickness protection. And what we'll do after we bond that in is to just kind of smooth that out. So I'll usually just kind of pass a fine grit diamond along that area to smooth it out so it's more even with the rest of the preparation. All right, so that after the try-in, what's not shown here would have been the air abrasion of the restoration and the application of the adhesive. We like to get that done, set aside first before we start working on the tooth. So now on the tooth, we're etching phosphoric acid, again, about 20 seconds. I usually will apply it on the enamel first. Usually we want the enamel to be etched a little longer. so enamel, and just kind of finish off on the dentin. After it's etched, then we kind of rinse that off. A little bit of drying. We're going to put in a new cotton roll there. Now we're applying our desensitizer and we suction the excess. Now we really, really scrub in that adhesive. We want to really allow for that nice formation of the hybrid layer. And now we're going to follow that with a light air stream to thin that out, allow for the absorption and evaporation um, of the solvents. And then now once we seat this down, I'm using a condenser to hold that in place. We can go ahead and run a micro brush along the margins just to remove the excess. And so we get 31 bonded in first and dialed in, just and all the excess cleaned up, and then following the protocol that we reviewed for number 30. And so this is the final. Now, a note on the material. So for number 31, and for any time I use CAMouflage, I'm always using the low translucency version. There's a low translucency and high translucency. A time where you might use the high translucency could be for this case that we did with an inlay just sitting in all the other unprepped areas of the tooth. It might blend perhaps even better. Maybe I'll try that next time. But I typically just go to the low translucency because I just find there's more warmth to the material. That is an A2 low translucency CAMouflage on 31. And that's about where his natural teeth are. Now, for number 30, because the BruxZir material is higher value and the BruxZir blocks are lacking application of what we use in the lab, a pre-coloring liquid during the centering and firing. I don't have enough time to talk about that, but it basically darkens the tooth. The blocks that we're using, higher value and a little bit lighter in shade. So that's an A3 BruxZir NOW. So a little bit more color. If we had used an A2 for both the CAMouflage and the BruxZir would have looked even brighter. So something that you can do if you have a shade above where you're at, a lot of times it falls into the brightness or value scale. And something that you can do to maybe improve on just dialing in or choosing the right block based on the brightness is to rearrange your Vita shade guide according to the value. And we can send that out, but it is available online on the Vita site. And so if you base your shades on the value or brightness, maybe that can help you dial in the case a bit better. So radiographically, I think it looks pretty good. Number 31, we were able to get that down, fracture taken out on the distal marginal ridge. On the radiograph, you can see a little bit of a radio opaque area on that mesial. That's probably just composite that I wasn't able to take away during the prep, but I was able to do most of it. So it looks pretty good. And what was great is the patient had an improvement to their biting. The discomfort left within a couple of days, and that's always reassuring. So really nice and happy with the way this case turned out. I'm going to check back in with Helen or Leah and Helen to see if there are any questions that I can help answer.
There are no questions at the moment.
All right. And you had asked me if we would have any. I almost always had questions. I thought this would be an interesting case that for sure we'd have something, but I guess not. So
You
thank
did
you
a
all.
very good job explaining the case, Dr. Chi. We do have a minute left, and I think we can use this time to invite everybody to join us for your next office hours on March 7th, where you're going to talk about number 8 and number 24, I believe, both
That's right. We're
anterior.
going to dive into the anterior zone. We got an upper and lower to work on. That'll be a great case.
Oh, there is a question right now, Dr. Chi. Do you do any stain or glazing of either restoration prior to cementation?
I did not, and I typically do not in the posterior. And many times in the anterior, I don't either. Depends on the case. If there's fewer, the case that we'll cover next month, since it's a single central on BruxZir aesthetic and the patient's natural teeth adjacent to, they do have quite a bit of color to them and characterization. So we did stain that one, and I'll review the staining for that. But these are just right out of the mill. There's no characterization applied to them. Thanks for the question. And thank you all again for tuning in. Hope you have a great one. Take care, and we'll see you on the next one.
Thanks, everybody.